All right, welcome back to Rook's Health video. Today we have back on an old channel guest, Sarah, who was part of our initial videos back about a year ago. So that's the last time. So today we're catching up with Sarah and how she has been getting on. And we have some very specific questions that some people have asked about the world of biomedical science, both the bit of studying side of it as well as the working side of it. So I will let you introduce yourself very briefly, and then I will ask you direct questions to get us started off. How are you doing, Sarah?
Doing great. Thank you. Thank you, Rick, for having me, actually, as a start. And I'm Sarah. I am now a registered biomedical scientist, and I work in the NHS.
Nice. So the first one off the bat is we both work in NHS, but the question a lot of people always wonder is what is the demand for biomedical scientists in UK particularly, because I'm a physiotherapist. This is not my area of expertise, but I get questions about it. So what is the demand looking like at the moment here in 2022?
Well, actually, right now, as I've spoken with a lot of my colleagues, including some doctors, is the right time to be in science. We have a very, very high demand, obviously, because of COVID and what COVID has done. It exposed the necessity of having, different healthcare professionals push our lifestyle in general and, help us explore disease. And because of that, with COVID, it also created a lot of job opportunities, including what I went into in my previous role. I was a part of the COVID response, and I was also testing for COVID, which we had a lot of people come in and train. Obviously, because of that, it shifted a lot of people's positions. Some of them went into leadership, some of them, shifted, they went into COVID, and that influx actually creates a really huge demand right now.
Yeah, that's the interesting thing that I found across general healthcare roles, particularly people coming from abroad and international applicants like ourselves, is the lot of times they're wondering, if they come in as a biomedical scientist, someone who did a bachelor's abroad or a master's abroad. I know that there is, they fall under like the tier 2 health and care working visa. So they always wonder what are the type of roles that you can actually have. So it's good to know that there's still a level of demand within the field particularly. And would you say, employment wise, if someone was looking for a job, let's say today or next tomorrow, when they went on NHS jobs or went in the private field, do you think they would struggle to find a job in terms of the whole application process? Or would you say that, if you're the right candidate, obviously it goes without saying, if you have the qualifications, would it be easier or is it hyper competitive at this time?
For a biomedical scientist specifically, the only thing might be locations. So obviously that influx, if you are someone who wants to live in a metropolitan city, that obviously has a less of a demand because they already have so many hospitals, they're very well staffed, things like that. You would usually get a bit more demand in different areas. However, it's not impossible. It's really easy to go on NHS jobs and just, try and find that out. Some hospitals, unfortunately, they do not provide tier 2 sponsorship for biomedical scientists, which I would advise, before, going into that role and applying to that hospital specifically, you speak with the HR team and message them, because they do have the license. They just don't want to offer it specifically to certain healthcare professionals. So in that sense, it is. And even if straight off you couldn't find a biomedical scientist job, and you do not have a registration as well, that's, double trouble. You can still also go into a band 4 position, a band 3 position, and, progress into that, because currently even the UK has changed its immigration status about the minimum amount of salary that you need to be able to be sponsored. So even band 3 positions and band 4 positions, you can still get, and during that time, you can get along with the hospital that you're in and eventually work your way towards your registration, which is what a lot of different healthcare professionals, including some of my colleagues in the previous hospital that I worked in, did. And they were very successful within a few months. And because they mentioned it to the council before they got registered that, oh, I'm with a hospital as well, so they kind of sped up the process.
Fair enough. No, that sounds similar to us as well, where you probably want to have a look to make sure that they're sponsoring your visa generally before you apply, which actually kind of briefly very well brings us to the next question, which is kind of, when you talk about your own experiences in the NHS or as working as a biomedical scientist, how has it been so far? I know most of your experience has been within the NHS, which is the biggest employer. There are obviously private side of things as well. So I know you don't do private particularly, but you do have some experience. What is that like experience been between the NHS working as a biomedical scientist and what you've heard from maybe some of your colleagues who do work in the private field? What's the big differences, or what's the similarities like between the two fields?
Yeah. So in terms of private, really you are still working for the patient, which is the main goal. However, there is one difference, which is in private, you kind of focus on getting a certain product or a machine, anything that you've been trained on or that you are a specialist in, for example, a certain technique. It depends what type of role that you're looking into. There's various different types. You can work in admin in private. So you do some of the science by, for example, you can arrange certain types of samples before you send them off, or you could actually work on, the scientific aspect of pushing a machine through so it could be manufactured and given to hospitals. It's still the same type of work ethic as well. However, it's a different goal. Over here, we're completely focused on just doing tests and giving out results, whilst over there, we are taking a little bit of a step back and working on these machines. Sometimes, certain companies, they do also kind of partnerships with universities. So they test out those machines with clinic patients and, for example, translational research, so they can push that new product through. And obviously, because of that and how tricky it can be in a research sort of setting, the pay is more. I think that's the other difference. You will still be able to do the exact same science, just with a different outcome, I guess. It's the same goal, different outcome. Yeah.
Fair enough. No, that sounds interesting. Obviously, you yourself have been working in the NHS for quite a while now, since last time I met. How have you found the NHS working, which is, I think, predominantly what a lot of individuals, at least I'd say, correct me if I'm wrong, to start their biomedical science career, because the NHS is a fairly readily available employer. Even as you said, location-wise, if you start spreading your wings beyond London in the highly concentrated jobs, opportunities get a bit easier generally. So, obviously you work in the NHS. How have you found the experience so far?
I think it's an absolutely amazing experience because, first of all, if you think about it, a doctor sees maybe 20, 30 patients a day. We see 1,000 at least, depending also how big or small the lab that you work in. And we also do have clinics, so we do see the patients physically as well and not just their samples. I think to be able to just focus on that as well and do the science and relate and connect things together, work with different healthcare professionals. So we arrange things with nurses, for example, training opportunities, and even now we are bringing the bench to bedside, which is by utilizing point of care equipment. So we have to train the people who are working in the wards, which could be doctors, nurses, assistants, physiotherapists, occupational health. We train them on working with these products as well. So these little machines to help. So I think overall the experience is absolutely amazing, and I think like any other person who's passionate about science, it's absolutely amazing, and to see that happen straight away, it's great, definitely.
No, that's a good thing. And I think even myself, as a physiotherapist working in the NHS, one thing I find is that it is very rewarding, and I do enjoy my job. It can be hard. I think that's one thing a lot of people, recognize. It can be hard. It can be busy. It can be intense because, as you know, the NHS is an ever-going cycle of is basically a machine that just keeps churning in, churning out, churning in, churning out. But you are rewarded, with the feelings of treating actual people, particularly. Now, obviously, from a biomedical standpoint, pathways is one thing we want to talk about. I know for a physiotherapist like myself, if someone asked me, I'm doing a physiotherapy degree, and when I finish, what are the pathways I can go down? I can go off on the hundreds of things that a physiotherapist can do, the different specialty areas, the different progression routes, from working in sports, working in hospital, being an advanced clinical practitioner, a first contact practitioner, and then even switching completely and going into managerial positions and operational leads positions like that. And that's a physiotherapy standpoint. I've always been curious as to what is that progression or variety of pathways in the biomedical field, because I think we touched on it a little bit last time, but I don't know what it is like now as well.
Well, yeah, definitely. So there's always so many things you can do, and the beauty behind this is with so many different things that you can do, there's also so many different things that you can add to what you're doing, so you end up in a different sort of space. So obviously you can just do it as it is, become registered, work in the NHS, just like a lot of specialities. You do your basic training, you become a general practitioner or a general biomedical scientist. You can then specialize and do another certification, and then you can also become a consultant, or also after that you can become also a practitioner within that. So there is some sort of movement within that field in a hospital setting. In terms of private, so private really varies. There is everything that you can think of. You can do a little bit of admin. So you can use those skills that you've had by understanding the types of samples, the types of things that it needs, the environment that you need to put it on, and work on like arranging it in like a sort of a blood bank or things like that. You can also, if you are, let's say, interested in the engineering aspect, you can maybe expand on biomedical science, work in a company that provides engineering, equipment and things like that, and work with them as a consultant. So whilst you do that, you can also gain a different type of experience with them, because what you're catering for is engineering products and things like that. You can also work in AI, which is what I'm doing at the minute. So through my master's, obviously, I've used that to kind of bridge my way into the computational world. So I have the knowledge and background of dealing with samples, doing analyzing tests and things like that. So I've chosen a specific topic within my master's to actually do both the biological and computational aspect. The computational took a bit of time because I'm not a computer scientist, but obviously my understanding of the biological aspect of what I want to see, what I hope the AI can benefit from, instead of a person doing it, a machine does it and it's better, you minimize errors. I know what I want, and so you work your way backwards, I guess. You can also do that. There's a lot of actually demand for bioinformatics right now, so you can use also your career path to bioinformatics. Yeah.
I've not heard about bioinformatics. I mean, from what you're explaining, these are some fields where it sounds almost like biomedical engineering, a little bit going into that role from that biomedical scientist role. As you said, AI is the one that obviously you're doing a master's in it, which you'll tell us what that master's in a second anyway, what that entails. But it's very interesting because I know that one of the standard roles is working in the hospital, working in a lab, but now you've obviously expanded that. You can go from it doesn't always have to be purely lab based work. You can go into other fields like engineering. You can go into a bit of biological technology side of things. Obviously, I presume some of these roles, particular areas of practice where you can work, you would need to an extent either maybe further education or further knowledge or further qualifications to go more specialist in this role, which is similar to physiotherapists, I think, or other healthcare professionals. Some of them you just need years of experience within that field to be able to progress within that field. Some of them you actually need certain specific qualifications, a master's module or a postgraduate study module to be able to go into that area of expertise. Is that how it's seeming as well for your biomedical science role as well?
Exactly. You've put it in a better way than I did, but yeah, it's something like that, I guess. Yeah.
Okay. And the next one, we will chat about what the educational side of biomedical science in the next video, but for this one as well, now obviously you working and studying at the same time, or you did a little bit of both at the same time. How did you find that experience? Because I think quite a few individuals will look to work as a biomedical scientist but also engage in some form of further education as well. How has that process been, and is it, I don't imagine it's an easy one, to be honest. Anyone working and studying is doing two things that people do individually as one.
No. To be honest, I don't think it's easy, but like anything else, nothing really comes easy. No, not at all. But I think for my year, when I was becoming registered, a new law came by, which anyone who is a part of the COVID response and certain professionals that are needed, you can work full-time, even though your visa says you can only work part-time. Yeah. So we were one of those professions, which is why I was able to work full-time and study full-time for my master's. And because I'm the type of person that I need something, I don't like to stay still. I like to do something to keep me going, I guess. So I didn't mind it, and whenever I needed, I did take a step back. So many of my colleagues as well, it wasn't just me actually. Some of my colleagues who came from Nigeria and Ghana, they weren't even registered. They became registered, they came, and they were doing their masters, so they were actually on a student visa, and they were able to work with me as full-time students. So you can still do that. The law hasn't changed at the minute, but it's only specific to the NHS though.
Okay, so you can't do it in private. That's the crutch. I think that's actually very important, because I was going to ask you, is that law still in place? Because I know a lot changed between around that 2020 2021 time period. A lot of different laws, particularly immigration laws, particularly towards healthcare practitioners, social health and social care. But also, even I think every time I look at the documents for health and care visa, there's always like, this is what everyone has to follow, except if you are a biomedical scientist or on the biomedical field. There's always the exception for individuals and biomedical scientists, which I think is what draws a lot of people towards it. But your perspective now, before we round out this segment of it, is just so people know, is that both of us were international students coming in. your, immigration side, visa side of things, is that still any issues at all, or is that being a biomedical scientist? Because obviously mine is well documented on my channel about the process of visas and immigrations for physiotherapies. Is there anything specific that is particularly different for biomedical scientists, or is it more or less the same with AHPs?
I think it follows the same thing as the AHPs. But I think the only thing is the registration. So if you're not registered, that's when, having that law to play in your favor won't be happening. But that's all that it is, really.
Yeah, the registration part, which actually is a very nice place for us to end this segment, because the next part of it, we will be talking a little bit more about registration. So if you are watching, make sure to stick to it if you're curious about registration, and also what the masters Sarah is actually engaging herself in now at the moment. Is we're going to talk about that in another shorter segment. Much appreciated, Sarah, for the little tidbits and the information you provided. I think it's quite useful. I mean, I've learned quite a few things just around that profession. So if someone asks me a question, although I will still be directing them to you guys in that field, I can at least give very basic answers. Anything you want to use to round out? Are you happy with that, or shall we move to the next one? It's up to you.